Hi guys, this is Nurse Kodia, and today we're going to be talking about type 1 and type 2 diabetes mellitus. Now, I'm going to give you a short story. For 3 days during my weekly shift, I decided that I was going to number and note the amount of patients that had either diabetes or hypertension. And at the end of the third day, I discovered that at least two out of my four or five patients were dealing with either hypertension or diabetes. Now, this is to state that we cannot deny the prevalence of diabetes and hypertension in our society. A lot of people struggle with these common sicknesses. So today we're going to be looking at diabetes. If you haven't watched my previous video on hypertension, do well to look out and watch it, okay? So we're going to start by defining diabetes 1. Diabetes 1 is an autoimmune dysfunction, okay? By autoimmune, I mean that people with this type of diabetes are genetically predisposed to having the disease, okay? They're born with this gene, and symptoms start to manifest earlier, like before 20, some as early as your teenage age, okay? Now, what happens is that the pancreas or pancreatic cells, which are your beta cells, your cells responsible for producing insulin, is not producing enough insulin. And if your pancreas is not producing enough insulin, then cells are not going to be able to manage the amount of sugar in your blood, right? Which will lead to a higher sugar levels or high sugar levels. So that's the situation with type 1 diabetes. Your body just does not have enough insulin. Now, with type 2 diabetes, which is a progressive disease, meaning that it's a disease that worsens or advances with time. And oftentimes, if people are not doing a yearly checkup, they find out when it's already too far gone. Their A1C is already high, and we're going to talk about that in subsequent videos. And at this point, the sugar is very high and it has to be managed with insulin, right? So that's why we call it a progressive disease. With type 2 diabetes, what happens is that your pancreas is actually producing a good amount of insulin, but your body is rejecting it because the amount of sugar in your blood is just too high for your insulin to manage. So your body is actually producing it, but your body is saying, hey, you just have too much sugar going on for us to be able to deal with. So if there's too much sugar in your blood, then it overwhelms your cells from managing it. All right. So with type 2 diabetes, the common factors that can lead to this are a sedentary lifestyle. Sedentary lifestyle simply means that you're mostly sitting down, just like I'm doing. No exercise, no form of exercise. You're mostly sleeping during the day. Now we have remote workers that work from home, right? So you're not making enough